Hi, Kim here again, and I just wanted to update you on the Botox treatment that I had done a couple of days ago. Today is December 11th, I believe. It's Wednesday, and I had the procedure done on Monday, so 2 days ago. So usually you don't start seeing anything until 3 days after the treatment is done. But I didn't get a whole lot of Botox done this time because the first treatment that I had, he said that he felt he put a little too much in my upper lip here. This is my affected side here on the left side, as I've mentioned before. And he felt like that that's what's sort of making this look unnatural right there. And it's also considerably added to my sort of speech impediment that I have now. So, but we're just going to have to wait for that to wear off. So he kind of put a little in right down here on my chin and some more around my eye to get rid of some muscle spasms that I had. So that's kind of the area we're addressing first, is getting rid of these muscle spasms that I have with the Synkinesis. Where the muscles just really contract and they won't do what they're supposed to do. So that's the idea of Botox, is to let those muscles relax for a little bit, and then hopefully when the movement starts coming back, when the Botox wears off after 3 months, that you'll be left with a more natural looking side of your face, rather than the contracting of the muscles that I had right here, of course, here, and I'm still having one in the eye and the mouth. It's not quite as pronounced as it was before. It was going way up over here, but that's of course because I have a lot of the Botox right here, and so that part of my lip is really just not moving at all. So when I do what's a natural smile, meaning try to smile on both sides of my face with an open mouth smile, I don't get I don't get the results that I'm looking for. So when I'm out in public, it's a little off-putting to me. Others say they don't notice it, but I do, and they may not notice it because I do a lot of different things to overcompensate for the asymmetry in my face. Cover my mouth when I smile. Use my eyes as an expressive feature, more so than from here down, so that people are sort of drawn up there, and that's what they see. I mean, you can see if somebody's smiling in their eyes, not just in their mouth. So that's kind of what I do, and I don't move my mouth a lot when I talk. Right now I am on this video because I'm trying to show exactly what it's like, the real deal. But when I'm in public talking, I would be more less inclined to be real animated in my facial expressions, and so that way, you know, as you see me now, when I'm talking, you can't really tell that anything's wrong with me, because I'm not really moving my mouth that much. So, you know, you can't really see anything that's overtly or just obviously wrong. So I think that's kind of why everyone says, well, I just never really noticed this about you until I started looking at your videos. And that's because I hide it. You know, like a lot of people do with different maladies. They, you know, if you have scars, you can cover them up with, you know, I have scars on my elbows, and I can cover those up. But when it's your face, you know, you can't really cover that up, so you sort of have to learn to make some other adjustments and compensations for it. So, you know, we'll see how everything pans out in the end whenever we go back in and reevaluate what's happened on this side when the Botox goes away, and see what we need to do on this side to even it out a little bit. So I think that's kind of what the plan is, where he's going with it, where the doctor's going with it. So I'm just going to trust him that he knows what he's doing, and I figure it can't be really any worse than it was before, and you know, Botox goes away, so it's nothing that's permanent. So I'll just keep doing what I'm doing, and I will update you again probably after a week, just to see, you know, if we have any more changes that are made, and then it'll be a few months before I'm back again to update you. So until then, bye.